Estás viendo Canal América, televisión dominicana para el mundo.
A Time for True show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. I'm your host, Dr. Bernard Fialkoff, and it's a pleasure to have you back with us again tonight. You know, the world is in a lot of turmoil. There's been a lot of chaos, unrest, and we're looking for solutions. We're looking to, where do we turn to? What avenue do we take? What direction do we take? And it seems like all of our norms, all of our stable points, our stable data has been shaken. And we're looking for stability. We're looking for social calm, to calm the unrest. And tonight we're going to deal with someone who actually has decided to take on this role beyond his profession, beyond the four walls of his office as a dental professional. And we're very honored and happy to have with us Dr. Cajouste Tony Jean Pierre, an MPH, a member of the International Medical Geological Association, a fellow and vice regent of the International College of Dentistry, graduated from the State University of Haiti Dental School, and currently assistant coordinator of research and faculty professor at that same school. Dr. Jean Pierre is member of the Scientific Council of the Haitian University and is also published, authored, and holds a laboratory health environmental degree from Quisqueya University under the direction of Professor Evans Emmanuel in the field of fluorosis and dental caries as it relates to our drinking water. There you see him at the Greater New York Dental Meeting this past week, where we had the pleasure of meeting at one of the drug education conferences. And he's here with us today at A Time for Truth. There you see him with the International College of Dentists Regents at the Greater New York Dental Meeting. And he's a very diverse individual. And Buddha, if we come up live, I would like to welcome Dr. Jean Pierre to A Time for Truth show.
Yeah, nice that you invite me on this set. It's a pleasure to be with you tonight. So I will share my experience and about dental field in Haiti, dental community, and dental humanitarian, and all together dentists can contribute in drug educational and violence.
Excellent.
Yeah.
Well, you know what? Let's start out first when you were young, because you know the viewers will be watching this, and there'll be someone saying, you know, I want to do that, or how do I get to that point? So when you were a young man, what were your dreams?
Young man, when I grew up in a small city like Sekakawajal. I grew up in a family who my father believed in education. And after graduate from high school, I decided to travel to Port-au-Prince to get university. And I get entered in the State University Dental School of Haiti, who I passed 5 years and I achieved my goal as a dentist. Now I'm serving my community and the country, and I hope all the knowledge I gain in dentistry field I can serve the world also.
Very nice. And now, from that dental approach, what led you then to want to educate and to actually, inform others, lead others, guide others? What led you to be a professor?
I would like, in Haiti there are a lack of dental professional involved in research. After finish then with my master in public health, I met the professor Evans Emmanuel. He saw my capacity, how I can conduct research, and he invited me in her laboratory. The name is Health Risk Assessment Laboratory in Haiti. This laboratory we study pollutant, natural pollutant could have effect on human health. Specifically, my topic regarding fluoride in drinking water and impact in human health, specifically dental caries and dental fluorosis. So I'm dealing, and I passed 2 years in the laboratory, and I published an article in 2013 at Major. The article dealing risk assessment of fluoride in drinking water and impact on human health. This is a case. It was a case study of Haiti, and we work in 4 cities like Cabaret, Akaye, Lily, Williamson. In this area, they have a high concentration of fluoride in drinking water that have a big impact on dental fluorosis. And after the study, we do the result, and as a result, the kid is more vulnerable to develop dental fluorosis and dental caries. And as perspective, we was planning to implement, instead of epidemiology study, just to maintenance the study. But with the instability of the country, we didn't achieve really this goal.
I see.
Yeah.
Okay. And so you kind of always been in the realm of trying to help the community at large and using your scientific background, and you like research.
Yeah, like research. Research. As a researcher, I know every researcher in the world knows research help a community and a country and to a huge thing. Like with doing research, you will collect a lot of data. Data will help you to preventing, to know how to do, and data help you how to manage a case and how to plan for the future. And also research help you to prevent, how to implement a program to prevent a disease, and or to release some issues about a pathology or disease.
Right, exactly. And in your country right now, I know there's been a lot of turmoil, and a lot of the viewers may have only heard bits and pieces. So tell us about what you see going on in your country right now. What is your, evaluation of what you see in your country?
Everyone knows Haiti now is so unstable. After the president was killed, Haiti is increasingly unstable. With increasingly unstable, we have violence, gang violence, and as everyone knows, instability is matched with violence, and with violence, we could have seen a lot of issues.
Right. And now, and so you're a vice regent of the International College of Dentistry, right?
Yeah.
Okay.
I'm a representative of Hispaniola Regent. It is a region of the large that we call the 43 Hispaniola. In this region, we have two countries, Haiti and Dominican Republic. The first region of the International College of Dentists in Haiti. As International College of Dentists is a worldwide organization involved in humanitarian and dental community research, education, and etc.
Absolutely. You know, it's a very interesting organization. And as you, I'm a member also. And, you know, I can see, you know, why you were inducted, because I see how you're really involved with your Haitian community. Now, when you were at the Greater New York Dental Meeting, I know we were speaking, and how do you feel, because I know you had mentioned a little bit to me about what you wanted to do in Haiti, how do you feel that the Haitian dental profession can go out in Haiti and maybe calm some of this violence and drug problems going on?
Yeah, you know, as a dentist, every dentist, a dental professional, we have a mission. The mission is first provide dental care and to bring some healthy to the community. Second, we have the other mission we have is to education, promote health promotion. I think in this way, health promotion every dentist could involve in all who can educate people to prevent disease. And as you know, drug has a lot of impact on general health and specifically in the oral health. By educating people, we will decrease some oral issues dealing by drug, and we can contribute for the future of Haiti in this way.
Absolutely. Well, you know, I think one of the things that I've always seen is when people see that you genuinely want to help them and that you do something that is an actuality rather than just talking, I see that they actually change. They calm down. Sometimes I've had people very angry, let's say just in my office, and when I actually show them how we've been trying to help them and they see it, it's interesting that their anger goes away. Many times they even apologize for being angry and they realize you were just trying to help them. So, you know, as a dental professional from Haiti and being an International College of Dentistry fellow, Regent, what message would you give those dentists out there watching, especially in your own country or the Haitians dentists in the United States of America? How do you feel that this dental profession and the Haitian dental profession or the Haitian descent could actually, what message would you like to give them on what can be done?
Yeah, as professional, you have a big mission to contribute of providing health for the community. Is the first, as I already tell. Second, you have to contribute of the entrance of the community by providing your knowledge. By, as you're telling, the International College of Dentists has a big mission: provide dental care by using humanitarian education and research. So I invite dentists worldwide in Haiti, Dominican Republic, and in the US. Is a big opportunity to be part of the best. I think it's the best project involved in the community, humanitarian, and help your community to a better future.
Absolutely. And you know, at the Greater New York Dental Meeting, we held a presentation. We had dentists there from the Dominican Republic. We had dentists there from Honduras. We had dentists from the United States, from different Latin American countries, from Haiti. And we presented this model that's been ongoing with sports, with drug education, with dentistry, in collaboration with the local governments. So, and you actually had mentioned that you had some ideas of what you wanted to do. Maybe you can share a little bit of that with our viewers now about your plan and what you want to do in Haiti.
Yeah, I was so upset, and with the dental meeting, I saw the many activities of the other dentists in Honduras and Dominican Republic, Colombia, dealing about drug education. The way I really appreciate is the holistic aspect of they use sport to provide education, and the approach they invite the policemen, the education sector, the the health ministry, the board of dentistry. It's kind of a big approach of public health too. The holistic approach. You invite to resolve a problem. You invite many sectors to get involved and be a part to resolve together. Because as human, you live in a community, you have to resolve all the issues or problem by holistic view.
Absolutely.
Yeah.
That's so true, you know, and my descent is actually originally Cuban descent. So my father was a Cuban physician, and like you said, the philosophy that I grew up in as a little boy, watching my father, was really beyond just in the office, but really going out and going to the community and being a doctor more than just within the office, but outside with the social structure of the outlying community. And it was a pleasure to have you with us at our meeting. You know, at that meeting, Dr. Gordon Christensen, who's like really world-renowned in dentistry, stopped by, and we have a video with him where he actually has also been very involved on educating against drugs. He was very happy to see what all of us were doing in our conference. And really, I think the message he sent to dentistry is that we need to do something. And Dr. Garay, you know, the president from Honduras,
Yeah.
he mentioned something. He says, you know, we have to go outside the four walls of the office, and we need to impact our patients out in the community. I want to ask you a question because you do so much, and a lot of people say, well, how's it possible? Because you're a father, you have children?
Yeah, we have 5 children.
You have 5 children, so you know the natural question that comes out
Yeah.
is how do you find the time to do all these activities?
Okay. My schedule is very tough. So on Monday, I'm practicing in the State University of Haiti. I go to university, go in the diagnostic services, teach students how to diagnosis oral pathology and the diagnostic services. And after that, I travel to my office to provide dental care. And then I'm a health professional of the Health Ministry of Haiti too. I'm a dentist practitioner at Center Hospital at Inch. I provide dental care in this area, and also I spend 2 other days in my hometown to provide dental community services, work with students, with a kid at school, doing fluoride, as you see in the picture, doing fluoride, sealant, do some extraction, restoration, and this is why this is all my contribution for my community in Haiti. This is all I share my knowledge to my community, my region, and my country.
Beautiful. And what is your hometown in Haiti?
My hometown is Cajouste.
Very nice. We got to
Yeah,
we got to definitely promote them, right? So
Yeah.
for all the people watching you, and we're going to be watching this show, and you know, very interesting thing also was in the conference that we were in. There were Dominican dentists and Haitian dentists, and one of the things we spoke about is that maybe when we do these programs that we talked about with dentistry and sports and education, on drug education, is that the possibility that maybe we could hold one that would be international on the same island, obviously, of, Española, but of the Haitian dentists and the Dominican dentists, and to do something. What do you think about that? And that maybe that could be an example for the countries to start getting along better together.
I hope there are a lot of issues between Haiti and Dominican Republic. Yeah, as professional, our job is to bring peaceful, like drug is an issue for for youth and Dominican Republic and Haiti. But if we can get together to resolve it's kind of problem, I think it's the best option. We can do it together.
Absolutely. I always find that when I have others with me, that they have ideas that I didn't even think about, and we share and we move forward. And it's a lot easier getting something done as a team than it is as an individual. The best example of that was in basketball.
Yeah.
With Wilt Chamberlain, who was an unbelievable basketball player, but he was always not on a team. And these other teams had more of a team aspect and always would win, even though he was an unbelievable individual, but he was just an individual. So I think what you're saying with the team approach and uniting it is a good idea. Now, on this show, a lot of leaders are going to be watching. What message would you like to give to the leaders in general who are watching the show?
Yeah, what I would like to advise any leader watching this video, so start by little thing. With little thing, you could harvest big change in the future.
Absolutely. And, your kids are what ages?
My kids at school? No,
No, your own kids.
no, I don't have I have a kid 6 years old. But the kids I'm working is in kids in the community and primary school.
Yes.
I teach them how to brush. I teach some 2 times per year we do the fluoride application for them, and some video provide them toothbrushes and toothpaste, and to keep the dental oral health good and a good maintenance.
Very nice. And now, originally also, I think you did some work with geology too, right?
Yeah. In my article that we published in 2013 is dealing it's kind of a natural pollutant,
Yes.
the fluoride and drinking water. Fluoride is both parts. Fluoride, it could have it could benefit and it could unbenefit. The problem is about the balance. Unbalance.
To have a harmony.
Yeah.
To have a harmony.
Yeah,
Yes.
this is why, as you know, it's kind of the problem we relate geology and health problem. And every dentist and dental professional know fluoride is the best element that dentists use to prevent dental caries in the world, by adding and toothpaste and more French and some other dental materials. We use fluoride just to bring or to enhancing our health.
Yeah. And then, what to the viewers out here, because I guess, especially to your own countrymen who are undergoing so much strife in their country, what message would you like to give to them in terms of how to move forward and start moving Haiti into a positive direction?
I think so. Every dental professional, medical professional, everyone, I would like an holistic approach to resolve the problem of Haiti. But I think everyone can contribute and to the better of Haiti. I think to bring a smile to Haitian people and contribute in her best future also.
Yeah, you know, it's true that sometimes very simple things.
Could have a big impact and change and could change the world.
Absolutely. So, sometimes I think we're looking to be too complicated, and it's not necessary.
Now, start by little thing. Sometimes, usually, little thing have big impact, a big change. It can change the world, change the matter of the world, change the humanity by and using by starting with little thing.
Absolutely, because you know, a lot of the humanitarian trips were, and like you said that you had done some also, is that you know the people see that you're really there for them. And recently, we did a trip like that into Dominican Republic. And what was interesting is to see the people when they look at you, because they're surprised, and it's not their normal day, and you're not from that area. So you're so right that that can go on where by doing these activities and by doing it as a profession, that they actually start getting some hope again. You know, I've seen that people, I think, have lost a lot of hope, a lot of trust that they've lost. There's a lot of mistrust in the world. And, you know, we're getting to the end of the show. And, you know, what would you like here at the end of the show? What would you like to say as a concluding statement and what you feel you would like to see happen in not only 2023, because we're near the end, but into next year, 2024?
So what I would like to advise for any dental professional, medical professional, or people who would like to involve in humanitarian. So I would like to keep the same word. Just try by little thing to contribute for the humanitarian, and by contributing in humanitarian, it could have a big impact and can change the human being health.
It's a pleasure to have you.
It's a pleasure to be on the set. I think it is not the last time. I wish I will be invited maybe in the future and this set again.
Absolutely. And you know, I know that you have plans on organizing like a dental, sports, drug education, government collaboration. So definitely we want to do that. For those of you watching, let's take the example of Dr. Jean Pierre. Let's take a little time. Let's give it to the community. It's where we live. Sometimes we look for complicated solutions and we forget that something simple that inspires others, that shows a genuine approach. You know, so we be genuine with each other, so we see that it's not artificial, it's not some kind of marketing ploy. Let's go in that direction, and let's see how we bring some humanity back, some brotherhood back. And I look forward with you and with the Dominican dentists that we met at the Greater New York Dental Meeting and all the executives of the Greater New York Dental Meeting, that we actually, as a dental profession, bring health, truthful education on the dangers of drugs, and make safe communities. It's a pleasure to be with you again tonight, and we'll see you on the next episode of A Time for Truth show. Good night.
Good night. It was a pleasure to be with you tonight.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got. But the world takes you down. You just keep moving on. at your feet.